Hello, good morning, everyone. I'm going to start discussion of the past paper MCQs exams. This is August 2019, the multiple choice questions exam, or it's a single best answer questions. So here we have first question: a 77-year-old man is at post-operative day 10. So he's post-operative day 10 following a total hip replacement. So he had total hip replacement. Patient operation had been uncomplicated and he had been well in the postoperative period to date. On the day of referral, he had suddenly developed left-sided chest pain. So here we have acute onset of left-sided chest pain and shortness of breath. So here he is asking about postoperative complication. It's already day 10, so it is a little bit late complication, and the patient has sudden onset of shortness of breath and chest pain. On examination, his pulse is 120, so he's tachycardic. His respiratory rate 22, so he's mildly tachypneic. His chest was clear to auscultation and his heart sound were normal. Chest X-ray clear and his ECG shows sinus tachycardia. Here this question, the idea of this question, he's asking about postoperative complication. This is day 10 after total hip replacement. The patient has acute onset of chest pain, left-sided chest pain, and shortness of breath, and the patient has sinus tachycardia. What's the most common thing we have to think in the differential diagnosis? What's the most likely diagnosis? And one of these: acute left ventricular failure, acute myocardial infarction, fat embolism, hospital-acquired pneumonia, pulmonary embolism. Most likely it's pulmonary embolism. Most likely here it's pulmonary embolism given the context of the scenario here. Day 10 after total hip replacement, left side chest pain, shortness of breath, and sinus tachycardia. All of these consist with pulmonary embolism. The next question: 32-year-old woman presented to her GP complaining of fatigue and palpitation. She says she has also lost weight without dieting. So he had unintentional weight loss. On examination, her pulse rate approximately 120, irregular. This is very important and relevant. We have to suspect arrhythmia, supraventricular arrhythmia, supraventricular tachyarrhythmia. Most commonly, it's atrial fibrillation. Her blood pressure is 140/88, and her body mass index 19. So here we have body mass index is so within normal range. In the low side, but it is within normal range. Her heart sound are normal. ECG confirm atrial fibrillation. So we have atrial fibrillation, and we have a chief complaint of fatigue and palpitation. So she had the chief complaint here. It's fatigue and palpitation. She had atrial fibrillation in the ECG. She had weight loss. Which of the following tests most likely to determine the underlying cause? So he's asking about underlying cause of her current presentation. The current presentation, she presented with atrial fibrillation. So what's the underlying cause? The cause of atrial fibrillation, so it could be two groups. It could be cardiovascular system related, or it could be non-cardiovascular system related. So here in this age group, 35 years old, it's unlikely to be cardiovascular system related. It's most likely it is non-cardiovascular. So here, full blood count, chest X-ray, thyroid function test, 24-hour Holter monitoring, fasting blood sugar. To know the cause, one of the non-cardiovascular causes, it is thyrotoxicosis or hyperthyroidism, and this patient has unintentional weight loss, and this patient has hypertension. So these blood pressure in the upper side. So these most likely consist with hyperthyroidism. So I think thyroid function test, TSH and free T4. I think this is the most appropriate answer here to determine the underlying cause of her current presentation. Let's move on to the question number 3. 64-year-old gentleman is seen by his GP, general practitioner. His result of home 24-hour blood pressure monitoring showed average blood pressure 150/82. The GP decided to commence him in the dehydrogenase calcium channel blocker. Dehydrogenase calcium channel blocker, it is like amlodipine or nifedipine as the antihypertensive. Which of the following is known side effect of this type of calcium channel blocker. Hypokalemia, this is wrong. Why? Hypokalemia is a known side effect if he's asking that, if he's mentioned that thiazide was chosen for the management of hypertension. Thiazide, hypokalemia is one of the known side effects for thiazide. Angioedema is wrong. It is one of the known side effects for ACE inhibitor and ARBs, the angioedema. So this is wrong. Ankle edema, this is the right answer. Ankle edema is the most common side effect of calcium channel blocker. Bronchospasm, this is wrong. Why? Bronchospasm, it is a complication for beta blocker. If the beta blocker was chosen for the management of blood pressure here, the bronchospasm could be a side effect. Bradyarrhythmia as well, it is wrong here. The dehydrogenase calcium blocker, it causes tachycardia, not bradyarrhythmia. The bradyarrhythmia is a known side effect for beta blocker. The non-dehydrogenase calcium blocker like diltiazem or verapamil can cause bradyarrhythmia. So the next question here, 78-year-old woman is admitted to the orthopedic ward for fixation of the right hip fracture. So here we have fixation of the right hip fracture. She fell while out shopping and sustained a right intertrochanteric fracture. So here we have intertrochanteric fracture on the right side. 6 months ago, she sustained a cholecystectomy fracture. So she had multiple fracture for her left hand when she slept and fell during IC with her. Her age is 78 years old. She's a woman. So her history include polymyalgia rheumatica and hypothyroidism. Medication include prednisolone, so she is on prednisolone, most likely for the polymyalgia rheumatica in low dose. She is on levothyroxine for hypothyroidism, and she is on calcium supplementation. Which of the following step would you take for this patient? Here we have to suspect. We have to think about osteoporosis, given the history of recurrent fracture, cholecystectomy fracture, and intertrochanteric fracture. So, and the patient, given the age of the patient, and given that the patient is on steroid, all of these, and the patient has hypothyroidism, all of these are risk factor for osteoporosis. So I think the most appropriate thing to do is to perform bone densitometry and start bisphosphonate if the T-score less than 2.5. This is the right answer to do here. 70-year-old woman present to the emergency department. She experienced episode of syncope while rushing to catch a bus. So she had episode of syncope. So here we have syncopial episode. An examination, you identify an ejection systolic murmur. So here we have ejection systolic murmur. So loudest at the right sternal edge at the side of the aortic valve. So at the aortic area. So radiating to the carotid. So this is radiating to the carotid side in the right side. So to the right carotid. So what's the most likely underlying diagnosis? Given this, the age of the patient and the syncopial episode on effort, because she got this syncope while she's rushing to catch the bus. So it is it's syncope with effort. And the physical examination finding ejection systolic murmur in the aortic area with radiating to the right carotid. All of these consist with most likely aortic stenosis. So we have to think about aortic stenosis, and we have to request for this patient transthoracic echocardiography to diagnose aortic stenosis. So the next question I will discuss in the next video. I hope these discussions are helpful and straightforward, and it will help with your preparation to your final exams. Thank you.